Hi, I'm Brigitte Sager with Manifest Wellbeing. I wanted to take some time today to explain the idea of functional medicine and answer that basic question of what is functional medicine. Before becoming a functional medicine provider, I worked in my local hospital as a critical care float nurse for about 8 years, and after that I was a primary care nurse practitioner for about 4 years. And the whole time I noticed that we were doing a really good job of fixing like broken bones and people with heart attacks, but continued to just add on more and more medications for people that were suffering from chronic conditions. And often my patients came in with symptoms that didn't add up into a diagnosis. And based on the guidelines that me and all my colleagues were taught with, there was no diagnosis for that, and I didn't have a lot of answers. And that led me to look into functional medicine more and learn what I'm working on today. So functional medicine tries to find the root cause of symptoms. So rather than diagnosing somebody with a condition and giving them a prescription to treat that, we find the reason that it's happening in the first place and try to get people off of medications and be symptom-free and feeling well. As I began incorporating functional medicine practices into my primary care practice, I started seeing my patients feeling better and being symptom-free instead of coming in for their regular follow-up to see if it's time to increase medications. And this was a real game changer for me and led me to devote my time full-time to functional medicine. So when we think about all the other animals on Earth and the fact that they don't need medications to survive, and they aren't having drastically increasing rates of autoimmune diseases, thyroid conditions, hormone imbalances, gut issues, toxicities, they don't suffer from anxiety and depression, this kind of points the finger at what we are exposing ourselves to rather than the fact that our bodies break. Our bodies are actually really intelligent and able to keep ourselves in balance and deal with a lot of the things we expose ourselves to for a long time, but we can definitely go past that tipping point, and that's when we develop symptoms. Learning functional medicine, I've been really surprised that a lot of what I'd been taught not too long ago about Western medicine isn't necessarily true. And I think culturally we've been taught that our bodies can fall apart and that we need medications to hold us together like glue. And those medications tend to have side effects and deplete nutrients in our body. They also don't fix us. They're just hiding what's still going on. And learning functional medicine, I've come to find that actually what's going on underneath can be fixed. And so I've had patients with chronic autoimmune conditions that think that they're stuck with it, and we find the cause of that inflammation. Why is their body reacting to itself? We address that, they get better, and they don't need medication anymore. And that's actually like my favorite part of this, is that I can help people find a way to not need medication anymore and feel completely better, which is pretty remarkable. I wanted to talk a little bit about what it's like to work with a functional medicine provider. For me, I have patients do an intake before our first visit, and it's a really thorough intake. I encourage them to add as much detail as possible and also upload any recent lab work over the last few years that we can use to connect some dots. Before our first visit, I go over all of that paperwork, review the lab work, try to make some connections, and come up with some more specific questions. During our first visit, I go over those questions, get a little bit more information, and then we come up with a plan that's really specific to my client and not me. So it's not me saying, I think you should do this and this is your next step, but kind of figuring out where my client is and what's practical. It's not going to make a big difference in somebody's life if I tell them to go do things that they can't make happen. Really drastic changes don't tend to be sustainable, and so I like to work with people and figure out where they're at, how motivated they are, and which areas they're most ready to make changes in, and we start there. I think one big thing that sets functional medicine providers apart from other types of healthcare providers is the amount of time that we spend with our clients. I spend 60 to 90 minutes with my clients on average for their first visit, where we go through their questions and come up with a plan. And I think this is pretty common for most functional medicine providers. After that first visit, we establish a plan for how often to follow up based on how the client's doing, what they're comfortable with, and their goals. Clients often work with functional medicine providers from anywhere from 3 months to a year or more. Some people 3 to 4 months, some people 3 to 4 years. It really depends on their goals and progress. Some people like to make big changes really quickly, and some people want to make small changes gradually with a lot of support. All of that is totally okay, and I'm happy to help people with whatever they're comfortable with. The thing about functional medicine is, if I wanted to just check your blood pressure and tell you have high blood pressure and give you a prescription, we could do that in 5 minutes. And that's something that I experienced in healthcare for a long time, was patients being treated that way. But with functional medicine, it takes a lot of time to get to the root cause of that. So why is the blood pressure high? I want to know about people's lifestyle, sleep, their nutrition, their stress, and review their recent lab work, talk about a ton of things to try to figure out the cause and undo what's going on, instead of just giving a prescription, which I think is really what sets functional medicine apart from other kinds of healthcare. So I think that should answer most questions on the basics of functional medicine. If you'd like to be tuned in for more videos, you can like and subscribe my channel, and I'll be posting more videos with similar content and go into more depth on a lot of the subjects that I brought up today. Take care.